I'm delighted to be here. I'm sorry I can't be here tomorrow. We have graduation at our school tomorrow, so I have to be back for that. So I'm going to talk to you about some reflections on opportunities and challenges for promoting urban health, and hopefully this may provide inputs to some of the discussions which are the core focus of this group regarding public-private partnerships. So I'm going to do three things. First, give you 6 reasons why we should be focused on urban health. And some of this will overlap with some of the things we've heard already this morning. And then I want to talk a little bit about our project, the Salurbal project, as an example of an international, very special international initiative to simultaneously generate evidence on urban health and also work towards building partnerships that allow us to translate that evidence into action. And then very, very briefly close with a few thoughts on some opportunities that I see based on our experience in Salurbal and some of the broader issues. So the first reason why we should focus on urban health, we've already talked about, so I'm not going to dwell on it too much, and is that the future of humanity is largely in cities. Joe already alluded to this earlier, increasing urbanization across the globe, but very notably, areas that used to be primarily rural, like Asia and Africa, are rapidly urbanizing. In addition, as Joe mentioned as well, this is not just about big cities, it's about a whole bunch of smaller cities that are growing and developing very quickly. In lower and middle income countries, over half of the cities are under 500,000 people. And so there are incredible opportunities to get in there as those cities are growing and developing so that they can be designed in ways that are healthier and environmentally sustainable. So certainly lots of work to be done in big cities, but there's this incredible opportunity in the emerging cities all over the world. The second reason, and this David alluded to this a little bit as well, is that the health implications of city living are variable and malleable. And if you think about the correlates of city living, probably the cardinal correlate is higher population density. In fact, that's what we use many times to define an area as urban. Also, though, diversity in race, ethnicity, national origin, and social class. Also, concentration of economic activity. Also, more intense and perhaps qualitatively different social interactions, and innovation and creativity as a cardinal feature of cities. Now, what does this mean for health? Well, there are minuses to this, potentially. Adverse environmental exposures can be concentrated and magnified in cities. Air pollution, industrial exposures, poor housing, heat and climate change impacts that can be magnified because of the urban heat island effect that we heard about earlier today. Physical environment effects on behavior, sometimes not so good. Urban design can promote sedentarism, stimulate consumption of processed foods. Sometimes limited access to services because of overcrowding, housing challenges, providing water and sanitation access to rapidly growing urban populations, providing health and social services to these populations. Sometimes access is actually limited in the context of cities, particularly if they're growing very quickly and the infrastructure is not keeping up. Also, potential for social stressors, conflict, violence, discrimination. But there are also potentially pluses. Income and work benefits. This is why people go to cities. Potential for better access to services as a result of proximity and greater availability. It's an opportunity to deliver services to more people in a more cost-efficient manner. Positive social interactions, cohesion, support, advocacy can all be good things. Creativity and social interaction itself as health promoting and health enhancing. And last but not least, urban policies can be used to promote health. So what does the data show about whether it's healthy or unhealthy to live in cities? I'm just going to show you 2 examples. This is data from the US, and from left to right on the figures, urbanization decreases. So the right is more rural, the left is more urban. And you can see, in this case, in both men and women in the United States, rural areas have higher obesity than urban areas, actually. Now, if we look internationally, these are different countries. The red dot is the urban area, the green dot is the rural area. Obesity is actually higher in urban areas than in rural areas. So what does this mean? Well, what does the data show? That the effects are highly context dependent. And this is very important. Because it means that there's things that we can do to change the relationship between urban living and health. And all cities are not the same. This is an example of data from several European cities showing that there's incredible heterogeneity in avoidable mortality, not only across cities, but within cities, across neighborhoods within cities. This is an example from the United States showing homicide rates across different cities, and you can see that the variability in homicide rates, firearm homicides, across U.S. cities is comparable to the variability that we see across countries. Another example, a paper by Chetty a couple of years ago that got a lot of attention, showing life expectancy by income in several U.S. cities. And we see the relationship that we know about, higher income, higher life expectancy. But if you look at the lower end of the income distribution, you see that there's a lot of difference in the life expectancy of low-income populations depending on what city they live in. So why is that? Why is that? And what can we do? What can we learn from this heterogeneity so that we can design, govern, and manage cities so that they can reduce health inequities? The third reason that it's important to think about health in cities is because the health consequences of city living are not the same for all. And you saw that in the Chetty slide that I just showed you. But I think it's very important to remember that cities are characterized by large social and health inequalities. This is data from U.S. cities from a Brookings report a few years ago showing that there's larger inequality in the big cities than in the U.S. generally within the U.S. And if you look internationally, you can see in this figure that the Gini coefficient, a measure of income inequality, is significantly higher in urban areas of countries than in rural areas of countries, which is why all the dots are to the right of the diagonal. So large income inequalities in cities, and these income inequalities are related to health inequalities, and this health inequality is manifested spatially in cities. So you might have seen some of these maps produced by the Robert Wood Johnson Foundation showing large differences in life expectancy across short distances within cities. So why does this happen? Well, it happens, it's a complex process, of course, but it's driven in part by residential segregation. Certainly, people end up living in different parts of the cities for a number of factors that have to do with resources, preferences, and discrimination. And those differences in the composition of neighborhoods reinforce differences in the resource distribution across those neighborhoods. It's a reinforcing mechanism. And this feedback, in turn, creates differences in neighborhood physical environments, environmental exposures, food and recreational resources, built environment, aesthetic quality, natural spaces, services, quality of housing, and in social environments as well. Safety, violence, social connections, local institutions, et cetera. These things, in turn, reinforce each other as well. And lead to the more proximal processes, behavioral and stress-related processes, which in turn reinforce each other and affect health. So here we have a system that's generating health inequities within cities. Of course, this is operating in the context of personal characteristics, which are also important, but do not fully exert their effects if we can't fully understand the impact, even of genetic factors, if we don't understand the broader spatial system that is generating health inequities in cities. The fourth reason, and Joe also alluded to this, why we really have an opportunity to think about how to improve health by focusing on cities is because health in cities is driven by factors at multiple levels, which creates opportunities for multi-level intervention. This figure, it's a complicated figure. Academics like these kinds of figures, but I just want to point to you that these processes are driven by global trends, also by urban policies and interventions in the middle of the slide. And here I want to highlight, as Joe emphasized, that it's actions of governments and others, both in the health sector, but also, most importantly, outside of the health sector. Economic policies and social inclusion, mobility and emissions control, urban development and urban housing, food policy and taxation, climate and environment, water and sanitation. All those things then shape the local and more proximal determinants, the living and working conditions in cities that affect health and the environmental sustainability of cities. So lots of opportunities for multi-sectoral intervention. The fifth reason why I think we should focus on urban health is because, in fact, cities are acting. They are doing things all the time for reasons that may be motivated by health, but often are not motivated by health, but they could have important health impacts and health equity impacts. And yet, even though we have a lot of evidence about the impact of these factors, theoretically, we don't have a lot of concrete evidence to really demonstrate this city did this, and as a result, they found this. And so I think there's a lot of opportunity to generate evidence on the health and environmental impact of policies that cities are implementing today for a variety of reasons. And I'll come back to this. Given our ability to pool together different kinds of data, to work with different kinds of information, I think there's really an opportunity here. This is an example of an evaluation that we did a number of years ago looking at the impact of a new cable car in Medellin, Colombia, on violence. And actually, you'll hear maybe later today from Olga Lucia Sarmiento, who has a great project in Bogotá looking at the much broader evaluation of the health and multiple health impacts of a new transportation initiative in Bogotá. The sixth reason, and our speaker this morning articulated this very eloquently, is that urban health and environmental sustainability are linked and reinforcing. So it is about improving urban health, but it's also about improving environmental sustainability. It's really both things. And the good thing is that we can do both things at the same time. Consequences of urbanization. We have one option, option one, more sprawl, more energy consumption, more car dependence, more processed foods, with all its consequences. Growth of urban footprints and adverse impact on biodiversity, biomass, and croplands, as we heard earlier this morning, higher air pollution and greenhouse gas emissions, less physical activity, more consumption of meats, less fruits and vegetables, bad for the environment, bad for health, bad social consequences, potentially isolation, violence, and mental health impacts. Or we have option two, compact development, energy efficiency, active transportation, sustainable food with all its benefits, less growth of urban footprints and reduced impact on biodiversity, biomass, and croplands, reductions in air pollution and greenhouse gas emissions, higher physical activity, better diets, better social and more inclusive environments. So we have different paths that we can take. So I already outlined these 6 reasons. The future of humanity is in cities. Consequences of city living are variable and malleable. Cities are home to large social and health inequities. Multi-level determinants provide opportunities for intervention. Cities as systems that can be influenced via policy, and urban settings as opportunities to promote health and environmental sustainability at the same time. And yet, major drivers of differences in health across and within cities remain unexplored. Cities are doing things, but rigorous evaluation is lacking. Health and environmental co-benefits are critical, but there's not as much empirical documentation yet, I believe. Opportunity for big data, multi-methods, and systems approaches, and the power of comparing and sharing across cities, I think, is untapped. And the Global South, I should say, I think is an incredible and untapped resource for understanding how we can manage and govern and develop cities so that they're healthy and environmentally sustainable. And I'm just going to spend a few minutes that I have left telling you about a very exciting project that we're working on to help address some of the things that I talked about. This is the Salurbal Project, Salud Urbana en América Latina, Urban Health in Latin America. It's funded by the Wellcome Trust. It's coordinated by Drexel University with 14 international partners, primarily in Latin America. We're really looking to create the evidence base needed to make Latin American cities, and we hope other cities as well, healthier, more equitable, and environmentally sustainable, to engage policymakers and the public in a new dialogue about urban health and urban sustainability and the implications for societal action, because I think we have to change the mindset of how we're thinking about this. And that involves thinking about health as more than healthcare, and also thinking about health and environment as traveling together. Not just the environment affects health, but what we do to promote health can protect the environment and vice versa. And also, our vision is to create a platform and network that will ensure continued learning and translation to the future. So this project is a bit of an experiment but it's a fantastic experiment in how to create an international network of partners to leverage information and knowledge and to transform our cities. Why Latin America? A highly urbanized part of the world, diverse urban landscape, one of the most unequal parts of the world. It's an area that has experimented a lot with innovative policies, so we have an opportunity to learn from that. This is the team. It's a terrific team across 11 countries. Olga Lucia Sarmiento, who's here and will speak later today, is a lead of the project as well, based in Bogota, Colombia. We have 4 aims: to identify city and neighborhood drivers of health and health inequalities among and within cities, to evaluate health, environmental, and equity impacts of policies and interventions, to employ systems thinking and simulation models to evaluate urban health environment links and policy impacts, and last but not least, to really engage the scientific community, the public, and policymakers to disseminate and translate findings, and hopefully draw lessons from this that will be relevant not just to Latin America, but to cities worldwide. As part of our first aim, we have identified a universe of nearly 400 cities that we're working to compile data for. We have a very comprehensive data resource that we're building with help from many others that we'll be analyzing to answer a number of questions. As part of Aim 2, which is about policy evaluation, we've identified 4 thematic areas of the kinds of policies that we think are important and have been implemented in Latin America: mobility and emissions control, social inclusion, comprehensive urban development, and promotion of healthy behaviors. And we've identified 6 policy evaluations that we're supporting: a housing intervention in Chile, an urban redevelopment project in Brazil, the Transmicable project in Bogota, evaluation of Vision Zero in Mexico City, and a bike share expansion project there as well, and a menu labeling initiative in Peru. Our third aim is really to bring systems thinking to this, because cities are systems. And so we really need to bring in the tools, the concepts and the tools of systems thinking. And we're doing this focused on transportation policy and food policy because of its relevance to the region. And we're really doing this in 2 ways: a more qualitative way, which is participatory group model building, which really brings together stakeholders to think together, bring their knowledge to think about the factors that are driving health and environmental outcomes in cities. It's a very cool technique that we've been able to implement, and then use traditional simulation model that is informed by the participatory workshops as well as the literature. So we really think of these 3 sources of evidence for urban health that we're pulling together. And last but not least, our dissemination and policymaker engagement aim. This is really important, and I really have to take my hat off to the Wellcome Trust for allowing us and actually encouraging us to include this kind of aim in a research project. This is not common, and I think it's terrific. Our objectives here are to, as I said, to promote a new way of thinking about the drivers of urban health, to engage stakeholders in research and evaluation process in order to shape the questions that we're asking and to facilitate dissemination, to disseminate our vision and our findings broadly, and to advocate and support for the translation of research findings into policies and interventions. And so we've done a number of activities for this aim: the participatory workshops that I showed you, where people came up with these very interesting causal loop diagrams building on their collective knowledge. A number of policy and dissemination events that we attach to each of our meetings, policy briefs that we've been developing to highlight some key issues, digital dissemination through various channels, and a Knowledge to Policy Forum event that we're doing every other year to bring together broad range of nonprofits, private sector, government, international organizations to really reflect on this issue and give us feedback, et cetera. So to finish up, opportunities in general, I think, based on our experience in Salud Urbana and more broadly, I think there's incredible opportunity for knowledge generation, data linkages, new data, data mining and processing, cross-city comparisons, great opportunities for policy evaluation for health and environmental impacts, capacity building in urban health, urban sustainability research and action, it turns out that the capacity building in our project in Cellular Bio has been a major byproduct, which I think will be probably the most impactful thing in the long run in terms of the continuity of this type of work. Because there's incredible resources in the Global South that are untapped for this kind of work. Opportunity for dissemination and translation of evidence into programs and policies. And last but not least, and particularly pertinent to this meeting, multi-stakeholder partnership and engagement, given the importance and the multifaceted nature of this problem that we're trying to solve. Here's some information, and I'll stop there. Thank you very much.